A patient presents with an inability to actively flex the right elbow against gravity through a full range of motion. Passive range of motion is full and previously screened. You place the patient's arm in a gravity-minimized position and achieve full elbow flexion. Which of the following grades would you assign to the elbow flexors in this scenario? The answer is grade 2. If a patient with a muscle contracture is able to complete his available range of motion actively against maximal resistance, then what muscle grade would they receive? The answer is grade 5. What is defined as restrictions of the joint capsule in synovial joints that occur in similar patterns during passive range of motion? The answer is capsular. What grade would someone receive when the clinician is unable to feel or see a twitch when palpating a muscle during manual muscle testing? The answer is grade 0. During a manual muscle test of the anterior deltoid, the patient attempts to substitute by externally rotating the shoulder and supinating the forearm. What muscle would this indicate that the patient is attempting to compensate with? The answer is biceps brachii. What end feel would be considered for elbow extension? The answer is hard. A patient demonstrates full passive range of motion of the glenohumeral and scapulothoracic joints during arm flexion in the sagittal plane. The PTA observes winging of the medial border of the scapula during assisted range of motion. What impaired muscle motor control or weakness would this be most indicative of? The answer is serratus anterior. What muscle do you test during a manual muscle test for the strength of internal rotation of the shoulder? The answer is subscapularis. You are asked to assess the strength of the knee extensors of a patient who has had a below-the-knee amputation. All contraindications have been cleared for performing the test. The patient has full range of motion and is able to hold against resistance. What grade should be given? The answer is grade 4. Which of the following bony landmarks is used to align the fulcrum of the goniometer during shoulder complex external rotation range of motion? The answer is the olecranon process. A patient is unable to demonstrate a grade 3 strength of the middle deltoid and supraspinatus when testing shoulder abduction. When testing grade 2, what position should the patient be in? The answer is supine with arm at the side supported on the table in neutral rotation. Which muscle is being tested during manual muscle testing for grade 1 scapular elevation? The answer is upper trapezius. If there is atrophy and weakness of the supraspinatus and infraspinatus muscles, what peripheral nerve may have a lesion? The answer is suprascapular nerve. The patient is unable to complete full range of motion against gravity, so the patient is placed in the standard gravity minimized position and is able to complete more than 50% of the range of motion, but not full. What grade should be given? The answer is 2-. Manual muscle testing is mostly used in this type of setting to assess mobility status, to determine discharge planning and needs for assistive devices. The answer is acute care facilities. You are examining the strength of the infraspinatus and teres minor. What does this test determine the strength of? The answer is glenohumeral external rotation. Which of the following is a precaution to performing manual muscle testing? The answer is osteoporosis.